You spit into the sink and there it is, pink, sometimes red. You have seen it so many times that you barely register it anymore, and if you thought about it at all, you decided you were brushing too hard. Here is the part nobody told you. Healthy gums do not bleed. Not when you brush, not when you floss, not when you brush hard. If you scrub the skin on your forearm with a toothbrush twice a day, it would not bleed. Gums are the same. Bleeding is not a sign of effort, it is a sign of inflammation, and that inflammation does not politely stay inside your mouth. I have spent 15 years in clinical practice, and the mouth is the single most ignored window into the rest of the body. Subscribe to Wellgevity and hit like right now. This is Dr. Steven, and every subscribe, like, and comment genuinely helps this information reach the next person who saw pink in the sink this morning and shrugged. Let me show you what is actually happening under that gum line, because the mechanism is more interesting than most people expect. Bacteria live in everyone's mouth. That part is normal. But when a film of them settles along the edge where gum meets tooth and stays there, your immune system notices and responds the way it responds to any invader, by sending blood. More blood means more immune cells delivered to the site, and to get them there fast, the tiny vessels in the gum tissue widen and become more permeable, meaning they leak more easily. That is why the tissue turns red, swells slightly, and splits open at the lightest touch. The bleeding is not damage from your toothbrush. The bleeding is your immune system already fighting a battle in that spot, and your toothbrush simply revealed it. Here is where it stops being a dental issue. Those widened, leaky vessels are an open door. The gum has one of the richest blood supplies of any tissue its size in the body, and when the barrier is inflamed and permeable, oral bacteria and the inflammatory chemicals your body produced to fight them do not stay local. They enter the bloodstream. Researchers can measure this. After brushing or chewing with inflamed gums, bacteria from the mouth show up in circulating blood within minutes. Your body then has to deal with them everywhere, not just in your mouth. This is why the link between gum disease and cardiovascular disease has been studied for decades and keeps showing up. People with moderate to severe periodontal disease have consistently higher rates of cardiovascular disease than people with healthy gums. Now, I want to be careful here because this is exactly the point where health content usually overpromises. The association is real, and it is well documented. Whether the gum disease directly causes the heart disease, or whether both are driven by the same underlying tendency toward chronic inflammation, is still genuinely debated among researchers. What is not debated is that chronic inflammation anywhere in the body contributes to the same process that damages arteries, and inflamed gums are a chronic inflammatory source that runs 24 hours a day, for years, completely unnoticed. Here is a pattern that comes up constantly, and it captures how this usually plays out. Picture someone in their late 40s, we can call him Marcus, who has had mildly bleeding gums for as long as he can remember and considers it completely normal. No pain, so no reason to act. A closer look turns up the things that cluster in these cases. He brushes quickly, rarely flosses, and has not seen a dentist in 6 years because nothing hurts. He also has borderline blood sugar numbers his doctor mentioned once. In cases built this way, the two problems are feeding each other, and that is the part people miss, because there is a second link here that is even stronger than the heart connection, and it runs in both directions. Elevated blood sugar impairs your immune response and reduces blood flow through the smallest vessels, including the ones feeding your gums, which makes gum infection more likely and harder to clear. Then the inflammation from that gum infection makes your body's cells slightly less responsive to insulin, which pushes blood sugar up further. Each one worsens the other in a loop. This is why gum disease is more common in people with poorly controlled diabetes, and why treating gum disease has been shown in studies to produce measurable improvements in long-term blood sugar control. That is not a small finding. That is your mouth affecting a number your doctor tracks on a blood test. Now the myth I most need to break. Bleeding gums do not mean you should brush more gently. That is the single most common and most backwards response to this. Backing off lets the bacterial film sit undisturbed, the inflammation deepens, and the bleeding gets worse, which convinces people to be even gentler. The correct response is thorough, consistent, gentle but complete cleaning right at the gum line, including between the teeth where a brush cannot reach. Gums that bleed on day 1 of proper cleaning very often stop bleeding within 1 to 2 weeks because you removed the cause instead of avoiding the symptom. I do need to flag the versions of this that need a real appointment rather than a better toothbrush. Gums that are receding so that teeth look longer, teeth that feel even slightly loose or have shifted position, persistent bad breath that does not clear with brushing, pus at the gum line, or bleeding that continues despite 2 to 3 weeks of genuinely good cleaning. All of that has moved past simple gingivitis into periodontitis, where the supporting bone is being lost, and bone does not grow back on its own. That needs a dentist, not a YouTube video. And bleeding gums that appear suddenly alongside easy bruising elsewhere on your body, or bleeding that will not stop, needs a doctor promptly, because that pattern can point to something in your blood rather than your mouth. Here is the 5-step plan starting tonight. First, clean between your teeth once a day. Floss, interdental brushes, or a water flosser, whichever you will actually use consistently, because roughly a third of each tooth surface is where a toothbrush simply cannot go. Second, brush for a full 2 minutes twice a day and angle the bristles slightly toward the gum line rather than straight at the tooth, since that junction is where the problem lives. Third, expect bleeding for the first week or 2 if you are starting fresh, and keep going. That bleeding fading is the sign it is working. Fourth, if you have not seen a dentist in over a year, book a cleaning, because hardened deposits below the gum line cannot be removed by brushing at any intensity. Fifth, if you have diabetes or borderline blood sugar, mention your gums specifically to your doctor, and mention your blood sugar specifically to your dentist, because these two are managing the same loop from opposite ends, and they often never speak to each other. Your mouth is not a separate system that happens to be located near your body. It shares the same bloodstream, the same immune system, and the same inflammation. Pink in the sink is the most accessible early inflammation signal you have. It costs nothing to notice, and it is the one almost everyone decides to ignore. I'm Dr. Steven with Wellgevity, and if this changed how you think about something you see in the mirror every single morning, subscribe to Wellgevity and hit like. Your support is genuinely what gets this information in front of the next person who thinks bleeding gums are normal. And tell me your age in the comments. It genuinely shapes which topics I cover next for the people actually watching Wellgevity.